The Navigating Disability podcast often discusses topics including disability, injury, mental health, and mentions of sensitive issues such as trauma and suicide. Listener discretion is advised. Please take care while listening. Welcome to Navigating Disability. Today we're joined by Chloe Jesson, mental health advocate, policy reformer, and Deputy CEO of Queensland Alliance for Mental Health. Chloe brings both professional expertise and powerful personal insight as a mum to a neurodiverse daughter navigating the NDIS. Her work is grounded in lived experience, driving change to ensure families are seen, supported, and heard. Join us as we talk about community connection, inclusion, and the systems that shape our mental health and disability services. Welcome, Chloe.
Thanks for having me.
Thank you so much for joining us. I'm really interested to hear about your journey. Can you share a little bit about your daughter and what early signs there were that led you to seek support?
Sure. So my fabulous daughter, interestingly, she is a twin. So we had an interesting time as they were growing up, kind of through toddlerhood, where we were comparing the two of them. So it was kind of easy for us to see differences between them. What it was with her was actually her brilliance that kind of made us think, oh, she's a little bit different. So for her, she started reading, teaching herself to read and reading when she turned 3. She would walk into a room and instead of having a conversation, she would just start labeling everything that she saw. So she had a huge vocabulary. Getting a sentence from her was like drawing blood from a stone. But in terms of just labeling things that she saw, she kind of knew every word in the dictionary, it felt like. So we thought, oh, that's a little bit interesting. So I engaged her with a speech pathologist to find out, how can we start having more conversations with her? I ask her how her day is and she's kind of glazed over and just wanting to point out what she can see. And that's where we started to learn that maybe she has what's called echolalia. She had to learn how to kind of speak in sentences. And we engaged an OT who recommended we have her assessed for autism spectrum disorder. I had worked in the disability industry and I was surrounded by people living with autism. So I kind of knew the things to look out for, and it was not surprising for me when we received the diagnosis. She now just says that she's neurosparkly. That's what she calls it. And really it's just her brilliance that kind of drew my attention to her being a bit different. Yeah.
I love how she terms it sparkling.
Yeah.
Beautiful. I love that.
We celebrate it.
Absolutely. That's lots to celebrate. Yeah. It's unique. So what was the process like getting the diagnosis and the accessing early intervention for her?
Expensive. So my son was already on early intervention for global developmental delay. So I knew how to access early interventions. And as I said, I worked in the sector, which definitely gave me a leg up. I knew that I had to, unfortunately, be quite deficits based in conversations I was having with the planner up here. And I went into that knowing I had to be really clear what I wanted in terms of support. I couldn't really focus on her strengths, which was very, very tough to do. But I knew that you have to kind of play the game, unfortunately, to be able to get funding. And I was able to just articulate what it is that she needed, how much that might cost, collected quotes from providers, had to go to a paediatrician, which cost an arm and a leg. They did some genetic testing, blood testing, which also cost money. Eye testing, ear testing. They kind of rule everything else out first. And then we were able to book in for an assessment. A speech pathologist did the assessment, and it was probably around a 6-month process. We were fortunate that in the meantime, before her diagnosis, because she was 4 at the time, she was able to get onto the scheme through early intervention without the diagnosis. And again, I just had really frank conversations with the planner about what it is that she needed. And I just made sure they didn't have to keep chasing me for things. I kind of came as prepared as I could be. And unfortunately, it's just that I work in the sector that I knew that's what you had to do. And I hear all the time from other families that no one tells you that. So you don't know. You kind of show up thinking that they should be the experts. And unfortunately, you have to come in and be the expert in something that you don't know much about. Yeah.
So what would be your recommendation for, because you're 100% correct, people they don't know what they don't know until
No.
they've been through it. For someone that's going through that diagnosis and wanting to access support, what would you suggest that they do?
I suggest that they find a community of other parents or carers that have been through it. So Facebook is a great place for that, as problematic as sometimes community groups can be. And I think that sometimes they can cause upheaval for communities because people are kind of it can be a bit dramatic sometimes. But I think if you can find a group, an online community where you can talk to other parents who have been through the process, if you hear of someone who knows someone that's been through the process, and pick up the phone and have a conversation with them about what steps they took, that's kind of the only way I think you can do it well. I tell everyone that I speak to, really, if I'm speaking about my children, I tend to mention that my daughter has ASD because it is something that I think is so special about her, and her curious mind and the way that she thinks. I do like to celebrate. So it's not something, I'm really big on stigma reduction, and the more I name it, the better I think it is for community. And what that means is that I have a lot of people reach out through friends to say, my friend that I know, or my sister or my cousin has a child, and we think maybe something's going on. Could you just have a chat with them and let them know what you've done? And so I'll, make the time to have a conversation. It's 5 minutes, and just give them those steps. You need to have everything prepared. Here are the things you can ask for. Don't word it like that. You need to word it like this, and just kind of pre-warn them that you need to be deficits based, as crappy as it feels. Hang up the phone after the planning meeting or step out and just say all the wonderful things about your child that you possibly can to make up for it. But for that period of time, for the hour or so, you just need to focus on the negatives or the things that they need to improve on. Find a community online, ask around. I think don't be shy about your experience, because if you can open up and talk about it, you're going to learn a lot more. People will offer support. Those of us that have been through it, really willing to help other people most of the time, because we all wanted that help ourselves.
100%. You could be a support coordinator. Are you looking for a job?
No, we never do support coordination. I couldn't do it.
Typical day look like for you and your daughter?
Typical day, a lot of routine. I am neurotypical myself, but there's sometimes a line where I think, does she get this from me, or is this the neurodivergence? I'm not entirely sure, this particular routine element. In my house, I work full-time and have worked full-time in an executive role for a little while now. So the day looks like we get up at the crack of dawn, and at this time of year in winter, it's before the dawn, and we have the same kind of process. She has iPad time in the morning. That's her way to start the day, and it's not worth trying to shift that. That's what works for her while I get ready. We do breakfast. The lunch is packed. She gets ready, we go out the door. And at school, we have school drop-off is quite ritualistic for her. If it's not a before school drop-off day, I have to stick around. I have to watch her do her lunchbox and her drink bottle and stand there until she walks into the classroom. She goes to school. Some days she has really easy, cruisy days. Other days, her teacher will send me a little email and let me know that she's had a bit of a rough one, so that we know what to expect when we get home. And when we get home, there's a lot of demand avoidance. So we've learnt over time not to ask her how her day was or what she did and try and get information from her. She'll offer it if she wants to. And I tend to find afternoons need to be really slow and evenings need to be really slow, because as a female with autism, she's already starting to do that masking, and she's learning in prep that kids like to behave and play in particular ways, and she has to work really hard to conform to that, to try and develop friendships. So she's exhausted when she gets home. And so, afternoons are quiet and simple for us.
Do you parent her differently to your other children?
No. So her twin brother, he quite likes a routine himself. I parent them differently in that they kind of need different things from me at different times, but the rules are all pretty much, the rules are the same for both of them, and the approach is very much the same for both of them. And that just makes it easier for me, I think, which might be selfish, I'm not sure, but he quite likes structure. He quite likes routine anyway, and it's all he's ever known. I do sometimes find that, so if she wants space and he wants to kind of be involved, I'm very quick to say to him, we'll just give her the space. Whereas if it's roles reversed, I'm very quick to say to him, we'll play with your sister. So I do in some sense sometimes parent them differently, maybe have different expectations of them sometimes.
And that's exactly what I was just going to say.
Yeah.
Because with the demand avoidance, some children, I certainly know my oldest child, would do everything that I asked when I asked. So then it's not fair if you're not asking the other child to do anything.
Yeah.
So
Yes.
it's really hard to balance
And
that.
I'm wary of that, but the times where I don't do that well, I'm saying I don't do it well. I don't know that that's the right. I don't think I do that very well. In that, yeah, I have an expectation of him that if I ask for something to be done, it's done. That he speaks to me in a particular way, that, there are higher expectations for him. And in a sense, and for him as a 6-year-old, he probably thinks, well, she gets away with a lot. So I think, and as twins, that already exists anyway, kind of pitching them against one another. And I think as they get older and wiser, I'm going to have to be more careful that doesn't breed any kind of resentment, or, that he doesn't feel like he's being treated differently or unfairly. So it's something I need to work on as a parent for sure. Yeah.
And how do you balance, because you've obviously got a corporate job, how do you balance being a carer, an advocate, a mum, work full time? How do you do it all?
Sometimes I'm a jack of all trades, master of none. I'm very fortunate. I have a very supportive husband. So my husband is stepfather to my twins, which is a big job to take on. I think they were 18 months old when he came into our life for our relationship. And so I do rely on my support network. I call on my parents if I need support. We've got before and after school care available for us. I have a babysitter I can call on if I need some time. I need my support system, and I have a brilliant support system, but I am the primary carer. I think I am fortunate in my role that I am a leader, which means I get to call the shots a little bit. And if I have periods of time where I work my tush off at my job and I'm quite hardcore in a particular project or a particular time. I work in advocacy in my job. So there are periods of the year where I have to be really focused in my work. And then I try and flexibly, when it's quieter, lean more into focusing in on parenting and focusing in on, my relationship. And so I have to be in flow, which, as I mentioned, I like structure. So sometimes there's tension there, but I do my best to not be too hard on myself. If I start to feel guilty that maybe I'm not doing enough as a parent, or I'm not doing enough as a mum, as a woman in the workforce, I try and not let that be something that kind of consumes me, and I just focus on strengths, and I try and do the opposite of an NDIS planning process, and I focus on what I'm doing well. I'm very fortunate that I have kids that talk about, my daughter says she wants to be a scientist when she grows up, and she's got kind of big dreams for herself, and I'd like to think that seeing me go and work hard and talk about the value of work and doing something that you love, I'm hoping that that's good role modeling, and that's how I frame it for myself when I feel like I'm doing a bit of a crappy job of doing it all well. Yeah.
So what does self-care look like to Chloe?
Self-care for Chloe. Oh, trashy TV. Like really
I like
trashy.
look, I'm there with you. I like a bit of trashy TV.
Yeah, like
Takes you out of your zone.
give me Married at First Sight. Give me Love Island.
I'd high five you with you.
Yeah. Lego Masters at the moment. I don't even like Lego. Just, something that is just mindless. Like I don't have to think about a plot line, and just let me be a couch potato. That's my self-care. And I'm good with a couple of hours of that. Like if I can get a solid 2-hour, 2 or 3 episodes of something, that recharges me. I'm very fortunate. I'm a very social person. I'm quite an extroverted person. Self-care for me is also going out and networking with people. I'm also very fortunate that I adore my work. I absolutely love work. And sometimes work is self-care for me from parenting stress. And then sometimes that swaps, and spending time at the theme park with the kids is my self-care from work stress. So I know I'm very lucky to be I feel privileged to be in a position where work is self-care sometimes, and binging around at home on the couch is self-care, and that's all I kind of need. I won't say no to a massage and a haircut, but I will, binge TV will do. Yeah.
Excellent. Are there any specific barriers or challenges that you've faced that you think any families will relate to?
Probably. I mean, at the moment, what I'm facing is, so for my son with the developmental delay, he hasn't got a formal diagnosis letter. And he's now 6 and he has speech pathology, occupational therapy, and physiotherapy weekly. And we're approaching a period of time where he will not be able to access early interventions unless he gets a diagnosis. And it won't be that clear cut for him. I don't know that he will get a diagnosis. I think he is just a little bit delayed. So barriers wise, I think probably more in my situation with him, I will find it more difficult. I think sometimes it is a barrier that it's so deficit focused, because sometimes it's hard to convey to someone who's not living the experience that you are what you're going through and why help is needed. And I understand that those roles are very much kind of just checking boxes and counting dollars, and that's not human focused and it's not person centered. And I know that it can't always be. So that can be a bit of a barrier. I also think a barrier.
Sorry, Chloe.
No,
your
you're right.
barrier there would be financial,
Yeah.
because as soon as he's off the NDIS, that's all out of your pocket, and there's no support there at the moment. So it's at the $193.99.
Correct. Times 3 sessions a week. Yep.
Times 3 sessions.
Correct.
That's a lot of money to have to
find. A lot of money. And it's, when there is such clear evidence that the intervention he has had for the last 2 years has helped tremendously, it's really tough to then think, well, can you imagine if we got it for another 2 years, what that then would do, like where he is now. Yes, he'll be okay for sure, but he still has, he still has low muscle tone. He still has difficulty with hand dominance and pincer grasp. But, these are things that impact daily living that I would not sit idly by and just let him go through. Growing up as a kid these days is tough enough without having anything making your day-to-day functioning even more challenging. Making friends is tough enough without having some difficulty with speech and not being able to kind of articulate yourself and communicate your needs as easily as your friends. So I think that,
What sort
I
of
would end up paying for it.
diagnosis would he be looking at, Chloe?
I don't think he'd get one. I just don't think he would. It was a developmental kind of delay. I don't know that he'd even meet the threshold of a global developmental delay on paper at when he reaches 7. I don't think so. His OT said maybe he might have a bit of ADHD, maybe, but really hard to tell for a 5 or 6-year-old who does just have a lot of energy, and his teacher's not really concerned about his attention. Certainly doesn't have autism. I don't think he would. He just needs a little bit of extra help, and probably not for much longer, but certainly longer than the next 6 months that he will have the plan. Yeah.
How does your personal experience influence your professional work in mental health and policy?
I don't think I could do my job without it. I have learnt more through my lived experience, and I use more of my lived experience than my master's in business. I'm studying a master's in public policy, and I still think, even with that, my lived experience is actually going to inform my work more. Big in my role, part of my job, so for the Queensland Alliance for Mental Health, we are the peak body for community-based mental health. So our focus is on the importance of people recovering within community instead of in hospital beds. And so I'm all the time talking about the importance of connection, the importance of relationships, the importance of capacity building, independence, and all of these things I live and breathe in my home life, and I see the power of, and I can storytell. I see the power in storytelling for advocacy. And if I didn't have stories of my own to tell, I probably wouldn't know how to tell stories on behalf of other people. So I think it hugely informs everything I do. In the mental health space, we do a lot with the lived experience movement. We're one of, I think, the most progressive sectors in terms of people that have an experience of something and using that experience as expertise. And so I like to think that I use my experience as my special expertise. I know how hard it is to navigate systems, and therefore it's easier for me to advocate for the fact that we need better coordinated systems. Yeah.
What would you change about the way systems support neurodiverse children and their families?
How much time do you have? I think that I would like the system to see families and children when they're old enough and have the ability to articulate. I think that system, the disability system, could take a leaf from the mental health system in respecting and acknowledging the expertise of those living with the challenges that they're living with. We have a very binary, one-size-fits-all kind of tick box exercise that has to happen, and that doesn't really speak to the way that impacts a person and what their life is like, and what someone might think is a good way of living may not fit in the box that the disability sector puts it in. So I think the system could probably trust the expertise of those on the ground experiencing the system, experiencing life, and just trust that they know what's actually best for their loved ones, or that individual, if they're old enough and able to communicate it, knows what's best for them. Let's trust that.
So what's your hope for the future and the systems that help scaffold the disability community?
I think that at every level of governance, at every level of government, there needs to be a percentage of people in those roles that live with disability. They should be decision makers. They're the ones that the decisions impact. And so they should be the ones contributing to that decision making, actually leading that decision making, not contributing. There is a percentage, and I don't know off the top of my head what it is, but there is a percentage of the population that lives with disability. There should be standards, especially within government departments and governance frameworks, that requires that proportion of the people involved in the process live with disability, including intellectual disability. So yeah, it needs to be reflective of the community that will be impacted by whatever the decisions are that are being made. Yeah, because you don't know what you don't know. And the people that sit up the top and make the decisions, that real top-down approach, they don't know what impacts their decisions are having. And they can hear the stories all they like, but you need more reflective of the community that you're impacting at those levels.
How do we change it?
Keep lobbying. I think it's about people not being afraid to speak up. I think a lot of people, and society has done this to them, there's still a stigma, and I think the way that we change it is by those of us who are in positions of privilege use that privilege for good and have conversations like this with people that can make decisions. I think that's what it will take, instead of buying into the stigma or kind of omitting information because it would just be easier. I think those of us who have a level of privilege because of our roles or because of the way we look or the way we are, we need to use that for good. We can't just sit back and take a free ride of privilege. Yeah.
So if you could reimagine inclusion, Chloe, here's a big one for you. If you could reimagine inclusion, not just as a policy, but in everyday life, what would it look like to you?
Inclusion for me is belonging. So inclusion isn't just that someone can access a building, for example. That's not, just because someone can get into a building doesn't mean it's actually inclusive. That just means it's physically accessible. I think that in everyday life it would be belonging. It will take societal change. I understand it's a big thing, but it would be, what was the quote I saw recently? I don't just want someone to ask me to attend the dance. I want someone to dance with me, so all good and well that you actually come to the disco.
I love that.
Yeah, but someone actually asked me to dance, let's ask me to participate, create an environment where I can participate in whatever fashion that looks, whatever I want it to look like, but make it so that I have a sense of belonging and I have a sense of connection in this space, not just that I can get my wheelchair up to the space. Yeah.
Yeah.
I really love that.
Love it.
Oh, good.
Yeah.
Looked at it like that. Yeah. As we start to wrap up, and we could start on the NDIS, but this is not about the NDIS. When you were talking about, working top down and people not actually understanding what's happening on the ground, we see that every day with the NDIS, the decisions that are being made. are not practical, they don't work, and they're made by people who I believe have no idea. What are your hopes, not only for your daughter, but for the disability community as a whole, and how can we bring on this change?
I think that what can happen in communities, and when you look at something as broad as disability, there are so many subsets of communities that are part of that community. And I think the problem I have in my own work in mental health, and I think still stands in disability as well, is that when there's fragmentation of messaging, when our community is going up against one another, that makes it really hard for us to all advocate to the same people in the same way. And I think the more we can band together and be a community and find what it is that we all are fighting for, what are the commonalities, what are the things that we can band together with the pitchforks and go after, that's much more powerful than subsets of communities with different messages, different language, trying, to grapple at government. They don't have time, and quite frankly, maybe not an interest level to hear from that many different voices, and it would be quite confusing. This group wants this group wants this. We can't please everyone, so we're just not going to do anything. Whatever we can find some commonality of, build a community and try and create a common language that everyone speaks so that it's really hard to ignore. It's a big proportion of the population that lives with disability. And if we all used the same language and spoke the same words and had the same messages, whatever those are, if it boiled down to three things, that will be so much more powerful than this distilled kind of advocacy that sometimes happens when we're pitting each other against each other. Yeah.
I love that. What are your hopes for your daughter?
Oh, my hopes for my daughter is that she continues to see herself as sparkly. Prep has been an interesting ride into society and what social settings look like. And so my hopes for her is that she keeps this level of confidence and self-assurance that she has through her schooling. And yeah, I hope she just continues to see herself as brilliant. And I'm going to do my darndest. My dying wish one day will be that she sees herself as brilliantly as I did the moment she started to kind of show her brilliance. I think that's my hope, that she sees that for herself. And I think most people with daughters, especially these days, would want the same. But yeah, for her, I think celebrate that difference. It's special. And my hope is that she sees it that way. Even though she'll probably go through some times in her life where she won't. Yeah, I hope that that's the overarching feeling for her.
And I think from a personal perspective of being diagnosed at 50,
wow,
you starting at 3, 4, 5, she's absolutely on the right track. So, I have been through the not feeling good enough, not being heard, having no self-confidence because I always thought I was wrong. And that's now me 50 years trying to undo all that. If she's brought up the way you're talking now, she won't have any problems whatsoever.
A force to be reckoned with.
Yeah, absolutely.
I hope so.
And I use the term neurospicy. I love
that too.
Sparkly. I might be changing.
Yeah.
But just if you keep that
It's
as
fabulous.
her, as her thing, she will come out the other side.
Yeah, awesome.
No doubt.
Thank you.
Chloe, thank you so much for your time today. It's been absolutely wonderful to speak to you. We will put your details up on the website for everyone to have a look at.
Great.
And reach out if they want to.
Please do. If anyone wants to reach out, I'm always available to chat. We've got to build community.
Absolutely. Thank you so much, Chloe.
Thank you.
Take care. Bye.